outreach. And I'm going to pick up where I just picked up, where I left off at. When I was explaining that there is an exercise that you can do. It's going to require 3 people, right? You, another person, well, you and 2 people. Have the 2 people engage in a conversation. Just have them engage in a conversation, just talking, facing each other, talking. And I want you to grab any piece of paper, kind of ball it up kind of like this, or roll it up like this, and go up to one of the persons and get behind them while they're talking in their ear. And as they're talking and having the conversation, let me make sure I'm set here. I got cut off earlier. I'm not sure what happened. Okay. You want to go behind them as they're talking and just start saying something. Just start saying something. Just keep talking. Just keep talking. While they're talking, you keep talking. And ideally, all 3 of you should rotate this particular role, right? Because everyone needs to know what it's like to hear someone talking in their ear while they're talking. When you do that, you're going to find, I've done the exercise, and some people can only do it for a few seconds. Some people, they become really irritable. They become really irritated by it. They become really bothered, right? And they're saying, no, I don't want to do this exercise anymore. Well, imagine having that happen to you, but you're not able to say, I'll stop. I don't want to do this anymore. I don't like this exercise, or I'll sit it out. This is what happens for many people who live with a severe mental illness. With an untreated severe mental illness or poorly treated severe mental illness. When you're looking at psychosis, and let me just kind of review from the part 1 that we talked about. We looked at serious mental illnesses. We defined those as serious mental illness, mental, behavioral, and emotional disorder resulting in serious functional impairments. I talked about how it interferes with or limits one or more major life activities. For example, people with serious mental illnesses are more likely to be unemployed, arrested, and or face inadequate housing compared to those without mental illnesses. I talked about why those are, because a lot of times when you look at severe mental illnesses, you're looking at illnesses that are started or some symptoms you saw when a person was younger, right? We also talked about in part 1 about how a lot of people, you see it with bipolar, for example, or mood disorder. A lot of people who were diagnosed with bipolar as adults, they were able to kind of look at their childhood and see how their mood was impacted. A lot of people who have an issue with substance abuse are people who may have had an untreated or poorly treated mood disorder, and then they just started self-medicating, and then now they didn't realize that what they were dealing with was a bipolar disorder. They just started self-medicating. I'm running into a lot of people, especially now with marijuana being, I don't know, it was illegal, whatever you want to call it, decriminalized, whatever the word is, that's using marijuana to deal with their mood, to self-medicate, right? And I don't know if that's a good thing or a bad thing at this point, because I think for some people it's not really looking to be, to me, a good thing, but okay. But again, that's what a lot of people are doing. When you look at severe and persistent mental illness, we're talking about illnesses that are so severe that they impact all aspects of an individual's life, and that these individuals who are diagnosed with this particular illness, which we're talking about schizophrenia, we're talking about bipolar. I also talked about in the previous broadcast that the term SMI is actually a federal term. It's not just, because people can say, well, I'm diagnosed with anxiety and I'm diagnosed with PTSD. I think that's severe as well. I get it. I understand it. I think all illnesses, whatever you're dealing with, it is a severe illness. It's severe to you. But when you look at severe mental illnesses, we're talking about illnesses that fit a certain category because of the impact. People with schizophrenia, for example, make up a small percentage of the population, but when you look at the impact of the illness is far-reaching, okay? So again, when we talk about, I'm just going to review this because I kind of went over this in the broadcast before. We talked about psychosis, being out of touch with reality. You have the premorbid phase, the prodromal phase, as well as the acute phase, and we want to make sure that we catch it before it gets to the acute phase. We talked about some of the symptoms of psychosis. Again, if you're joining this second broadcast, I would encourage you to take a look at the part 1 of this. We look at delusions, hallucinations, disorganized thinking, reduction in ability to maintain social relationships, changes in emotion, thinking, perceptions or behaviors, changes in appetite, reduced energy and motivation. Why is that? If you do this exercise and you do it right, you'll get an understanding. It's hard when you're living with something that's always in your ear. When you're living with these, we're not talking about, when we talk, people just thinking things to themselves. We're talking about hallucinations. We're talking about delusions. You can see why. Because when a person withdraws like that, they're trying to focus on themselves. They're trying to kind of gain some kind of equilibrium, right, within themselves. So it's important to realize that. So when you look at a person who's living with severe mental illnesses, as we said before, that person may become more violent, right? People say violent. But as we said before, just because a person is diagnosed with severe persistent mental illness, they are no more violent than anybody else. However, we do know from research, if the person is not taking their medications or poorly treated and there's drugs involved, then that is not the case. Then they can become more violent. But when you look at it, when the police approach an individual, right, and we talked about why that is, why, and again, I don't want to repeat so much from the first broadcast, but we said before that people with a severe mental illness are more likely to be unemployed, arrested, or to face inadequate housing. Why are more people likely to be arrested? As I said before, many times it's because of their connection with, who they're connected with. But I wanted to kind of switch over. I'm going to leave that there. Why I titled the broadcast what I entitled it. And for many people know, there's this broadcast, there's this TV show that's called Atlanta that comes on FX, okay? And I'm reading out of this from ebony.com, where they did like a little review of a particular episode that I saw, and I thought it was really good. This particular episode, one of the characters says to the other one, they're talking about therapy, and he says, "I'm poor. Poor people don't have time for investments because poor people are too busy trying not to be poor. I need to eat today." And I wanted to share that because we were talking about in the other broadcast how people like to always put other people down by saying things like, oh, black people don't care about mental health, this person doesn't care about mental health, and that's not true. What is true is that the black people or the people you know may not be focused on mental health, but that's not true when you say that black people are not concerned about mental health. The issue is poor people are not concerned, are not always concerned, because, and it's not even about they're not concerned, it's where the focus is. It's hard to talk about therapy and to be focused about, all this other kind of stuff when you got to worry about how you're going to eat. When you have to worry about how you're going to pay your bills or where you're going to sleep. It's harder. When you look at the hierarchy of needs, one of the first things we need is to feel safe. We need to eat. If we're not feeling safe and if we don't have any money to eat and if we're not sure where we're going to live, that's going to be the priority, right? So I just kind of wanted to share that. But also in one of the broadcasts, in this episode, of Atlanta, there was an episode where the two characters had got, two main characters, they were arrested and they went to jail. And while they were in jail, there was this gentleman who came in jail that was drinking urine. And people said he was like a regular in jail, that he comes in and out of the jail all the time. And as we saw this episode, this particular writer started looking at the rate of mental illness inside jails is 4 to 6 times higher than on the outside. And he was talking about how that negatively impacts black people because a lot of black people wind up in jail. For me, again, it's not necessarily, the race, we can point to that. It's about income. More poor people wind up in jail. But anyway, I just wanted to share that as well. But I also wanted to kind of go from there to the point I wanted to make in this part 2 of the broadcast, is that when you look at jail was never designed to treat people who had a mental illness, right? It was never designed to do that. My concern is that we put we put the responsibility where the responsibility should be. I'm afraid that we're getting to this point where that we are blaming the police, we are blaming the prison system. You know, we're acting as if the warden of this jail, this prison system, is going out on the street wearing a sign and saying, all of you who have a mental illness, come to jail. That's not what's happening. The police are not going out on the street and just saying, if you have a mental illness, come to jail. Let me arrest you and let me take you to jail. That's not what's happening. What you're seeing, when you see individuals that are arrested or has to be called for a psychiatric emergency, or when you see a person that's in jail, don't complain about the jail system. Look in the mirror, because what you're seeing is that is a failure of another system. It's not the jail system. It's not the jail's fault that people with a mental illness are in jail, and right now that they make up a large proportion. You have, in some states, you have more people who are in jail, with a mental illness, untreated mental illness, who are in jail than you have in the mental health system, and that should not be. What is the problem? And that's what we need to begin to ask ourselves these questions. It's not the police's fault. The police would much rather, I can tell you from dealing with the police, they would much rather, okay, if there's a mental health crisis comes up, calling somebody else to deal with that so they can deal with another matter. They would much rather do that, right? They would much rather that these individuals, that somebody else from the mental health profession, a mental health field, comes out to the street, deal with these individuals, a person in crisis, and get them help, as opposed to take them to jail. The jails know that jail is not the place. Prisons know, the prisons, jail, prison, whatever, is not the place. Police officers know that is not the case. If you heard what I said earlier before I got cut off, I was telling the story of this this client that I was working with, this homeless client that I was working with. He had actually missed his court date. And because he had missed his court date, again, we're talking about someone who was not treated properly with medications, not taking medications, and I want to make that clear. Having a severe and persistent mental illness is like an illness just like any other. It can be managed, it can be treated, okay? Just like diabetes, hypertension, having a severe mental illness can be treated. But part of treating the mental illness, treating the illness, is understanding that it is a chronic illness that needs to be treated. Just like you have to watch what you eat with your hypertension or maybe with your diabetes, you have to exercise, take your medications, eat right, all that type of stuff. It's the same thing when you're living with a severe mental illness. So if you're living with a severe mental illness, you have a responsibility to manage it. If you're living with someone who has a severe and persistent mental illness, you have a responsibility, as much as you can, as much as you're able, to encourage them to manage their particular illness. You can't just say, the person's taking medications now, they're fine. Because one of the reasons why I wanted to talk about psychosis and go through the different phases is because when a person's living with a severe mental illness, you're going to see, you more than likely may see some relapses. You may see some changes in behavior. We want to catch it before it gets worse, right? So if a person has hypertension, you want to take the medications, you want to eat right before your hypertension, your symptoms turn into kidney failure, right? You want to catch it before it becomes worse. It's the same thing with the chronic mental illness or a severe mental illness like schizophrenia or bipolar, for example. When I talked about Kanye West, you're looking at an ill person who is not managing their illness well, right? And unfortunately, you have people around him who are not helping him manage his illness or appear not to be helping. But anyway, I'm not going to get on that tangent. But again, when we look at the jail system, the prison system was never designed for this. So when you have, I think a lot of people, rightly so, are complaining about what's going on in jail. They're complaining, all these people going to jail and they're not getting their mental health treatment that they need. Oh, they're, blah, blah, blah. The police are, they're arresting these people, they're taking them to jail. And all of our anger and energy is directed at the jail and the police. What I'm saying, let's kind of change that a little bit and put that anger and energy where it belongs. That anger and energy, let's start with, number one, looking in the mirror, asking yourself, what did you do? If you're living with a loved one and you know that loved one has a chronic illness, you should not have to call the police to come and manage your loved one. You shouldn't have to do that. You live with them. You're engaged with that individual. You should know who their treatment team is. Well, I don't know who their treatment team is because they never gave me the information. Well, one day you should go down to the clinic. You should go with your loved one to the clinic. See, the thing is, we wait until it's a crisis. It's hard to manage things in a crisis. When you're in a crisis mode, what you're doing is you're trying to get out of that crisis mode and manage it. You want to do things before it becomes a crisis. Before it becomes a crisis, you and your loved one needs to go down to the clinic. You need to attend one of the appointments while your loved one is not in a psychotic phase, while they're more amenable to you meeting the treatment team and getting documents signed saying that, which gives them permission to call you if there's a problem. Again, even if you don't have those documents, you can always call the treatment team. They may or may not give you a lot of information, but you can always give them the information. But again, before there's a crisis, you want to already have these things done. Before it's a crisis, you want to know what is there a crisis team in your particular area. Every place does not have a crisis team, doesn't have a mobile crisis team, okay? But if you do, you want to know what it is. If your loved one is connected to a clinic, you want to find out from them, what is the after-hour procedure? Who do I call if there's an emergency? I can tell you every clinic that's receiving Medicaid dollars, Medicare dollars, through an insurance company or whatever, even if your loved one is not getting Medicare, Medicaid, is required. We have to have a procedure to handle emergencies after hours. You need to find out what that emergency procedure is. You need to know what it is, okay? So there's some things that you should do. You should not expect or just assume that a police officer who's never met your loved one, who's never met your family member, people are saying the police should be trained. I can tell you many times the police are. Many times, all the times I've dealt with a police officer, I could say maybe one time the police did a wonderful job. And it wasn't that one time, wasn't that the police officer was just young and just didn't know what to do or could have handled it a little better, but it was no problem. He had a senior officer that was with him. But my point is, many of the police officers can handle mental health crisis better than you can. Right? So just kind of keep that in mind, that they kind of do this often. The only time we hear about a problem with a police officer is when there's a problem. Okay? Well, all I'm saying, and this is my preaching, my rant for Saturday morning, is that if you're a person that's living with a person with a severe and persistent mental illness, you want to become aware. You want to become informed. You want to know what the resources are. You want to try to know what your loved one's relapse signs are. While there's not a crisis, you and your loved one, everyone should be sitting down and figuring out, okay, tell me, what are your triggers? What are your stressors? If you're the person living with the illness, you should know what your stresses are, what your triggers are. You need to share that with your loved one. Everyone should have a crisis, should have a relapse plan, because you want to catch things before it gets to the point where you have to call the police. Now you have a full-blown, your person is a full-blown psychotic episode, and you have to have a full-blown psychiatric emergency. When you see a psychiatric emergency where the police have to respond, it is a treatment failure. It's somebody failed, okay? Because the police should not have to come out and deal with a psychiatric emergency. Where was the mental health staff? And I say that as a mental health person. Where was the mental health staff? Where was the loved one? Okay? What happened? Well, how did this person get to where they are now? We need to ask those questions, and then the person themselves has to take some responsibility, right? So it's not just the jail system. So when we look at that, we have to ask, well, where's the money going? Okay? Where is the money going? Why don't we have enough beds in psychiatric facilities? Why don't we have enough psychiatric facilities? Why don't we have enough ACT team members? I mentioned before in another broadcast, I talked about AOT, assisted outpatient treatment. Why are we not pushing assisted outpatient treatment, right? If you have a loved one that consistently is going in and out of jail, you need to ask about AOT, and I talked about that on another broadcast. You can look that up on our Facebook page, right? You want to request that. why are we putting all the emphasis on the jail? We're acting as if it's the jail's fault that people are coming to jail. It's not their fault. The prison system deals with whoever comes through, and they do what they can. So I think the thing is, we have to decide. It's real easy to pick on the jail system. It's real easy to pick on the police when we're talking about a mental health crisis, because it lets us off the hook. And I'm saying today that we should not be let off the hook. We, meaning society, the rest of the society. What are we doing? Okay, what are the politicians doing? What are the psychiatrists doing? What is the licensed professional therapist doing? What are you guys doing? Okay, I can tell you what you were doing, but I won't, because I don't want to kind of get into a fight today, because I think this is my first broadcast on Facebook. I usually do this on YouTube, but this is my first broadcast on Facebook, so I'm going to be nice. But I want to say this. When we look at mental illness, severe and persistent mental illness, people with severe and persistent mental illness need help, they need support, and it's not easy, right? I think a lot of clinicians come into the field and they like going towards the easier diagnosis. They don't want to deal with the harder diagnosis. When you're living with someone with bipolar, or you are the person who has the bipolar, we're talking about serious. Those illnesses are just that. They are persistent. Schizophrenia, bipolar, these are illnesses that take a lot of work, that take a lot of support. These are the illnesses that we need more help in. And I'm just going to leave it like that for now. But a lot of people tend to always look for whatever is easiest. Okay? I want to be a coach. I think that's great. Okay? Be a coach. I want to be a therapist. I want to work with this particular population. Everybody wants to pick, many people want to choose the easier route. But when we talk about schizophrenia and bipolar disorders, we're talking about disorders that's not easy. There's no easy answer. We're looking at ongoing persistent illnesses. We're looking at the need for ongoing support. These are the people who wind up in jail. These are the people who engage with the police. And as I said before, they engage with the police because the police are out on the street. The police are the ones that people call. When something is going wrong, people call the police, and the police have to show up. Let me say this, since this is my first time on Facebook, audience, let me say this. If you have to call the police for a psychiatric emergency, I would encourage you just to think about a couple of things. Number one, when you call the police, you call 911, monitor your tone, okay? Don't act like it's a crisis. Oh, they've got this person here and they have to come. Because the police are going to come in hot based on what you're saying, the energy that you're putting out. You want to be calm, all right? You want to be calm. When they ask you questions, does this person have a weapon? Because that's one of the questions they ask. Oh, I don't know. Don't add on to it. Don't be all hyped up, or, calm yourself down when you have to call the police, and be clear. That's number one. When the police show up, you want to try to meet the police, right? And this is what we do when I have to call the police for a psych emergency, because when we call the police for a psych emergency, let me say this: in some jurisdictions, if there's no crisis team, and if you're pretty sure that this person will need to go to the hospital, you may have to call the police, because the police are the only group of individuals that can transport a person against their will. So let me just stop there. But let's just say you have to call the police for a psychiatric emergency. Okay, you call the police, 911, you call, you want to be calm, you want to explain why you're calling. The police come out. You want to go to meet the police, right? You want to meet the police, and you want to be in a calm manner, and you want to explain what's going on. You don't want to run out there to the police, oh, I just don't know, just all of this going on. Because remember, the police, they don't know you, they don't know your loved one, they don't know or the person that you're calling. They're responding off your energy. So if you're all hyped up, then they're going to automatically become hyped up. But if you respond in a calm manner and just explain, hey, the reason I was the one who called you, this is why I'm calling you. The person is, they're not a danger, they're not angry, they're not, anything like that. I'm just calling because da-da-da-da-da. And you want to explain why you call the police, to the police why you calling. This is why I called you, and this is what I'm hoping. And you need to know why you call the police, right? Why are you calling the police? Okay? You want to explain that. You want to lead the police in if you can. Now sometimes you can't, but if you can, you want to lead the police in, and you want to just kind of explain, okay? Usually what I would do, I would suggest, if it's your loved one, if it's a person that you have a relationship with, you want to let the person know that you're calling the police. You know, John, hey, what's going on right now for you? I'm kind of concerned. I think maybe we need to get you to the hospital. I'm going to call the police because I'm concerned, and this is why I'm calling the police. You want to let the person know why you're calling the police so they won't be surprised when the police show up, if you can do that. That's number one. And you don't want to say it like in a mean way, I'm calling the police on you. No, you want to let them know, hey, I'm calling the police because I think, you know, where we are now, we may need some help, and I think the police can help us because they can help us get you to the hospital. Because I think maybe, you know, maybe this is what you need to do. You want to be, again, it's all about calm. It's all about managing your energy. Okay, so the police come. So like what I usually do, I would suggest you meet the police. You lead the police in, and you introduce the person. Okay, John, remember I told you I was going to call the police? This is the officer here. They're here to help us. They're here to, hey, we may need to, you know, get you to the hospital here. And then you let the police do what they do. Okay? Again, you don't want to aggravate the situation by being all emotional. The police are there for your loved one, not for you, right? So keep that in mind. Also keep in mind is that when the police come, if your loved one is displaying signs of that the police may consider dangerousness, because keep in mind, it's your loved one. You know this individual. They don't know the individual. All right? This is the first time they're meeting the person. Even if the police are trained, in some jurisdictions, you have a lot of police officers who go through CIT training, that they call it. You know, training to deal better with individuals with mental health, having a mental health crisis. But keep in mind, these are still police officers. I tell this story one time. We had this individual who had was in the clinic, and we had to call the police to transport. They sent an officer who was trained. Officer did a great job with the individual, but the individual would not take his hands out of his pocket. Right? He wouldn't take his hands out of his pocket. And he just, it was difficult to kind of calm him down, to bring him down. And we brought him down. He was less agitated, but he was walking back and forth, wouldn't take his hands out of his pocket. I'm there, you know, we did this, we made the handoff. I'm with the grandmother, trying to encourage the grandmother to, you know, let the police do what they do. And because she was not being very helpful. But I understand, you know, she was emotional. She didn't really know. So we're trying to calm her down. So this excellent police officer, you know, he did what he needed to do. He was a CIT trained officer, but the individual would not take his hands out of his pocket, right? He wouldn't respond to the command. So the officer had to do what the officer had to do, and that is, you know, it was him and another officer. They took him, you know, down to the floor. The individual down to the floor, and everybody was screaming, no, don't do that, no, don't do that. We're moving people out of the way. No, this is what they had to do. Turned out the guy had a nail, one of these, I think somebody told me it's called a construction nail. You can look that up. I don't know if that's a thing or not. But it was a real long nail, like really, really long nail. And I happen to know that this gentleman that a few months earlier had taken a nail and it was trying to take his eyes out with this particular nail. So this nail was a weapon, right? So it was a good thing that the police officer did do this. What is the moral of my long story that I'm telling you? I'm telling you that even when the police come out, keep in mind that these are police officers, that they're going to do what's safe or what they feel is safe. You as a person who called may not like what they're doing, but you were the one who called. If you could manage the symptom, manage what's going on, then you didn't need to call the police, okay? So as I was sharing with people when I do these broadcasts, I'm talking to like different audiences. I'm talking to people who are living with the illness. I'm talking to people who are not living with the illness but are impacted as a family member. I'm talking to people who are within the church. I'm talking to people who have no idea what I'm talking about. So sometimes for my new audience, what seems like I may be like all over the place is because I'm talking to 4 different audiences and I'm trying to kind of talk to everybody at the same time. So if you're the person who's calling, keep in mind that the police officer may not handle the situation the way you think they could or they should, and which begs my question, then why are you calling the police? If you could have handled the situation, why didn't you just handle the situation? Why are you calling the police? That's number 1. Number 2, if you do have to call the police, think about utilizing some of the tips. Number 1, being calm. Don't aggravate the situation by becoming overly emotional yourself, right? Don't add on to the drama, okay? Try to meet the police. When they come, try to lead the police in. Explain calmly to the police officer why you call them and what you need. Also keep in mind that when the police officer comes, and this was not my topic today, but when the police officer comes, he or she may not see what you see. Because I can tell you many times when the police show up, an individual, even if they are actively psychotic, they may respond differently to the police. They may become much calmer. The police in many jurisdictions, they are not going to take an individual anywhere if they don't see a reason to take the individual, right? So, which is why it's really important for you, if you're living with a loved one, to know what the medication they're on, to have a conversation, to have had at least one conversation with their treatment team members so that you know who to call in a crisis. You don't want to let the police to be the first person group that you have to call. You want to try to call the crisis team first, because the crisis team can walk you through some things. Because see, what happens is the police come out, if they don't see what you see, they're not going to take your loved one anywhere. Because many times when we call the police, you want the police to take your loved one to the hospital. They may not do that if they don't see a reason to do it, if you can't make a case. Also keep in mind, your loved one not taking medications is not a reason for them to be admitted into a psych ward. Just because they're not taking medications, they have a right to not take a medication. What you want to ask yourself is, what are the symptoms? What is going on with them as a result of not taking medications? That's what you want to kind of focus on, because you can't make people take medications if they don't want to take it, right? So again, just kind of keep that in mind. Let me get back on track here. Talking about the jail system. When you look at individuals who are in jail or the number of people in jail, I'm encouraging us, that we need to advocate, we need to put our elected officials on notice. We need to pay attention to what's going on in the mental health profession. We need to put the psychiatrist, the psychologist, the clinical social worker, whoever these therapists are. We making it, oh, we got to do therapy, Well, if you're pushing therapy, then we need you to do your job. We need you to step up when it comes to severe and persistent mental illness if we are pushing therapy. Therapy, mental health support has to go beyond just certain type of illnesses, certain types of diagnosis, certain types of people, or easier illnesses or easier diagnosis. We need people to step up to kind of work with individuals or who are dealing with severe mental illnesses, where we look at schizophrenia and bipolar, which is what when we look at Kanye West and things of that nature. So we need people to kind of step up. So when you look at, every time you say, and I want people to do this, you find yourself saying, black people don't do this, they're not interested in mental health illness, I want you to slap yourself. When you say things like, oh, people in the church don't care, I want you to slap yourself in the mouth. When you say things, gently. When you say things like, get mad at the jail system, or you get mad at the police, I want you to gently put your hands over your mouth. And when you do that, I want you to ask yourself, well, what am I doing to change the problem? What am I doing? What am I doing? Ask yourself, have I taken any classes on how to deal with people living with mental illnesses? Have I done that? I can tell you, I teach mental health first aid, and I can tell you the number of people that show up to those classes are very slim, okay? Number two, ask yourself, what am I doing? Am I sitting down? Am I developing, helping my loved one, or have I developed a crisis plan? Do I know what to do if a crisis, a mental health crisis were to occur? If I have to call the police, am I helping? Am I being a help to the process, or am I bringing more drama to the process? See, anybody can report about what's happening in jails. Oh, so many people are in jail. Though the police officer did this, but are we reporting? Let's report about what we're doing. Okay, are we holding our elected officials accountable? Are we pushing for different mandates, different legislations? Are we taking advantage of the resources that are out there? Are we pushing AOT, assisted outpatient treatment? Are we asking for AOT? What exactly are we doing? Are we just saying, okay, it's the police's job, it's the jail system? What are we doing about the problem? So I just wanted to come back to part two to finish this up. Again, you can go listen to part one, and watch part one, and get some about everything I said. But I just wanted to kind of make sure we were talking about psychosis. What is psychosis? Just means being out of touch with reality. There are different illnesses where you will see the symptom of psychosis. Drug-induced psychosis. Sometimes you might see it when you talk about AIDS in the later, when a person is really sick. You might see it in Alzheimer's. You might see that psychosis. You see psychosis in schizophrenia. You see it in bipolar. But when a person is actively psychotic, they didn't just become actively psychotic overnight. There were different phases. The whole idea, what we try to do, is catch it before that person becomes actively psychotic. If you have an individual, whether it's you or your loved one, you've been diagnosed with schizophrenia, bipolar, or a chronic psychotic disorder, or chronic illness, you have to know that there are different phases. It's an illness that has to be managed. It's an illness that's an ongoing illness, right? You shouldn't be surprised when you start having symptoms. It's an illness that has to be managed, right? So when we look at psychosis, many people that are in jail because they were actively psychotic at the time. They were having hallucinations, delusions, disorganized thinking. They were out of touch with reality at that moment, which is why they came to the attention of the police officer, whether through somebody called them or the police noticed them out on the street. They came to the attention of the police officer. They were arrested. They were taken to jail. Many times when an individual who is psychotic or dealing with a severe and persistent mental illness and they're psychotic, they're not taking medications, many times when they go to jail, you find that they've been to jail before, so now they have a warrant. So that's what they're in jail for. Because the jail systems are not designed, they were never designed to handle this many people with mental health illnesses. People may not get the support that they need. I want you to be more outraged about the fact that people are not getting mental health support in jail. Yes, it's something to be outraged about. But I want you to be more outraged about the fact that individuals are not getting mental health support in mental health clinics. Why don't we have, what are the mental health clinics doing? Why don't we have enough mental health hospitals? Why is it that a police officer's only option is to take a person to jail? The police has arrested this person several times. They know this individual is psychotic, but they have no place to take the person. Why don't we get angry enough to demand more money be put into more more psychiatric hospitals, more emergency beds, right? You take a person to the hospital. Sometimes the hospitals don't even have enough beds because we cut down the number of beds in inpatient. Remember? Years ago, we cut down the number of beds in inpatient psych wards. We cut down the number of beds that the emergency rooms have to handle psych emergencies. We cut down the beds. Why did we cut down the number? We cut down the number because we had this great idea we're going to do so much in the outpatient sector. But we're not doing it what we said we were going to do. We're talking about society. We need to do more. Become angry or outraged about the fact that we need to do more. When you see a person who is not taking medications, or maybe they've been hurt, or they hurt someone, Instead of don't just be angry about that. Be angry about the system and angry enough to do something. Don't wait until Mental Health Month before you become, encouraged about mental health. Before you want to start talking about mental health, talk about mental health now. Mental health is something we should be talking about all the time. And we're not just talking about, individuals who can go pay to see a therapist and they see their therapist and they feel good about their therapist. That's one aspect of it. But we're talking about people who really need help. We're talking about people with severe and persistent mental illnesses. These are the people who are getting beaten up out on the street. These are the people who are being sexually assaulted out on the street. These are the people who are sleeping out in tents. These are the people who are being taken advantage of. I've had clients sometimes, we've gotten them a place to stay. You come back a week later, all the drug dealers have moved from the neighborhood. They know the individual is vulnerable, so they move into their apartment. They take over the apartment, right? So now you got drug dealers in these individuals' apartment, and once they're in, it's hard to get them out. Okay? These are the people that need help. When you talk about homelessness, these are the people that are out on the street. These are the people, like I said, who are going in and out of the prison system. These are people that are being taken advantage of by so-called family members, friends. When you look at what's happening with Kanye West, and yes, I got to go there again. This guy, my thing is, I'm thinking about starting a petition for someone to do an emergency petition to get him into treatment, because all people are doing is taking advantage of him and for ratings. That's all what people are doing. One of the symptoms when we look at hypomania is that type of behavior that he's exhibiting. But because we don't like him, we hate his guts. People are not even looking at what's going on with him far as mental health wise, right? Individuals who live with someone with a severe and persistent mental illness, sometimes we know the struggle, and that, as my friend would say, the struggle is real. We know about our loved ones. Sometimes they'll pick up the phone and they'll start calling all our friends, saying things that are sexually provocative, right? That we know our loved ones who are like that, untreated, poorly treated, untreated. You buy food, they'll throw away all the food. They'll go up and down in the neighborhood and start knocking on people's doors and saying different things. Sometimes when you have a person who has an untreated or poorly treated mental illness, some family members can tell you about the embarrassment that they felt, that they go through. You feel the embarrassment, you feel the shame because of what your loved one is doing because they're not taking their medication. And then you have the individual that once they start taking their medications or they get back on track, they're able to talk about how they felt. So untreated mental illnesses can bring about feelings of shame, feelings of embarrassment, because you're doing things that you normally wouldn't do. You're saying things that you normally wouldn't say. Untreated mental illnesses or poorly treated mental illnesses, the person doesn't have a filter, right? Because when we talked about untreated, severe, and persistent mental illnesses, we're talking about illness that impact the way a person thinks, the way a person behaves, the emotions, okay? So kind of keep that in mind. So I'm going to stop here. Again, this has been It's Getting Better All the Time Mental Health Outreach. You can find out more about us by logging on to our website at igbattmho.org. And for those of you on Facebook, oh, she talks so fast. Yes, I do talk fast. You can slow it down. And I'm sorry about that. But if you don't take anything from this broadcast, I want you to know that there is help out there. If you're a person who are living with a severe and persistent mental illness, I want you to know there are other people who are living with a severe and persistent mental illness, and they are living well. You do have a reason for living. As my sweatshirt would say, make hope an option. Hope is always an option, right? You may feel like giving up. You may be taking medications that you think that's not working, or you may be a person who's living with a negative life situation, and you may feel like giving up. You may say, I tried it, it didn't work out. I'm telling you to keep trying. You may say, I knocked on this particular door, the door didn't open, knock again. You may feel like giving up. I want you to understand that yes, you may feel like giving up. You may feel like people don't understand what it's like to be you. Some of you are listening to me. You look real good during the day. You look real good at work. People don't know that as soon as you go home from church, that as soon as you leave work, or the first thing you do is go to bed, and you're in bed the entire weekend. They don't understand that you may not even get up to take a shower. You may get up maybe once to use the bathroom. They don't understand how depressed you are, how you go to sleep crying yourself to sleep, how tearful you are, the thoughts that go through your mind. But I want you to know that you have a reason for living, and that hope is always an option. It is indeed getting better all the time. Why? Because hope is always an option. Just, you owe it to yourself to keep moving forward. You may say, yeah, I've been doing this for a long time, but you don't know what tomorrow is going to hold. Tomorrow can be a turnaround. Next week can be a turnaround. You owe it to yourself. You've been putting up with everything that's been happening to you all this time, all the physical abuse, the sexual abuse, the negative things that people have said about you all of this time, all right, for 5, 10, 15 years. You owe it to yourself to see what the next 5, 10, 15 years is going to bring. Again, it's getting better all the time. Mental health outreach, please log on to our website. Email us. I love getting emails. You can write us, Post Office Box 7432, Silver Spring, Maryland 20910. Email us. We do offer assistance and support. If you're a person that you're living with a severe mental illness, you or your loved one, you have questions, you're trying to get resources, we can help link you to resources or link you to people who can help. Log on to our website, igbatt.com. Find out more about us. God bless you.